You recently had a knee replacement surgery, and now that your surgical wounds have healed, you're still having pain or other problems with your knee. Could these problems be related to a defect in the parts that were implanted in your body? My name's Dan Burke, and I can help you answer those questions. Now, what is a knee implant? It generally consists of three distinct parts. One is the femoral component, or the part that attaches to your femur, which is the long bone in your thigh. The other is the tibial base plate, which is the part that attaches to the smaller bones in the bottom of your leg. The third is the articular surface. That makes contact with both the patella and with the tibia. And it moves in and out and up and down to flex your knee, like you would do with a normal knee. Traditionally, in the past, knee implants have had degree of flexion, which is essentially the degree of range of motion of 110 to 120 degrees. Recently, however, as a marketing tactic, companies have been generating knee implants that allow for a much wider range of flexion or range of motion in patients. They're sold as being better for more active and younger patients to be able to do more activities. These implants allow sometimes up to 165 degrees of flexion. And just to give you an idea of what types of activities use that degree of flexion, it's things like squatting or being a catcher in baseball. So typically, these aren't the types of activities that folks who've undergone knee replacement surgery will engage in. In any event, these high flex knees in recent years have come under fire because they're typically weight bearing, and they've been shown to have rates of failure that are far beyond what the traditional knee implants had. Some studies have shown that high flex knees have a failure rate of 1 in 3 implants, where there's loosening of the components and the need for revision in upwards of 10% of the cases. One such implant was manufactured by the Zimmer Corporation. It's known as the Next Gen Knee. There are several models: LPS Flex, CR Flex, and Gender Solutions, which involve a smaller implant that are placed in women's bodies. One of Zimmer's own key opinion leaders, one of the doctors who placed a number of these implants, recently concluded last year that although the product is still commercially available, he decided it should not be used in any patient. Again, my name's Dan Burke, and I'm a lawyer at Parker Waichman. Pick up the phone, give us a call. We could walk you through the process. We'll investigate your claims, we'll obtain your medical records, and we'll see if there's something we could do to help you out. Call us at the number below, and we'll be happy to investigate your claims and help you out. Thanks so much again for taking the time to watch. Have a great day.